Wakati Mungu anasema kwamba ninawasihi muweze kuitoa mili yenu kama sadaka ama dhabihu iliyo safi, dhabihu ya kuteketezwa. And sometimes unaweza jiuliza, now how do I become a sacrifice? How do I offer myself? You only need to be obedient to the word of God. And definitely the sweet spirit of Jesus will give you the direction. Unataka kwenda wapi, unataka kufanya nini? Away from kuhubiri. Sasa tuingie katika masuala tuingie katika masuala ya matibabu, masuala ya kiafya, masuala ya physically. You know, we want to really understand everything we need to know. Na leo tumetenga siku ya leo kwa ajili ya watoto wetu. Na niko na muuguzi, a good friend of mine, ambaye kando na kwamba yeye ni nurse, she's a very good friend of mine. Na yeye amesimamia wauguzi. So natembea na watu wa nguvu, you know. JCK Hospital all the way from down here. Atakuwa anatuambia details of where they are, some of the services ambazo wao wanafanya. Lakini niko na Daktari CHRISTABELL CHEPKEMOI. Mara nyingi huwa namuita Kemboi, kumbe ni CHEPKEMOI. Karibu sana ndani ya nyumba.
Thank you for having me, Sele.
Long time.
Long time. And you look good.
I do. Thank you so much. Today nataka tuweze kuangazia complications in newborns. Wale watoto ambao wanazaliwa, alafu kuna kuwa na changamoto, kuna kuwa na complications. Wakati mwingine hizo complications hata hatuzielewi. So kindly jitambulisha kwetu, because every morning we are having new people on board. Jitambulishe, utuambie wewe ni nani, umetokea wapi, unafanya kazi wapi, alafu kisha baadaye tuingie katika mada yetu. Karibu sana.
Asante sana. Naitwa CHRISTABELL CHEPKEMOI. I work in JCK Hospital. It's in Lumumba Drive, just next to Park University. I work with patients, maternity mothers, and when delivering them. So I'm passionate in maternal care and child care. Yes.
Wow. Sasa karibu sana, tunataka kuangazia complications in newborns. Wakati ambapo tunazungumza juu ya newborns, are we giving them an age, tuseme 1 day, 1 month, ama who are they?
Okay, newborns or neonates are children who are between 1 day or from birth to 28 days.
28 days.
Yes.
Okay.
So neonatal complications are health conditions that affect them. Zina affect from birth to 28 days. They are very common.
They are very common.
Yes.
So it's not something to worry me about.
It's not. Well, it can worry you if it's not acted on immediately.
Okay.
But ni very common. Common conditions are like birth asphyxia. Birth asphyxia ni difficulty in breathing. So when the baby wakati amezaliwa, wakati mtoto ako tumboni, huwa habreathe, anapata ile circulation of oxygen through the mother. But immediately they are born, the first cry inakuanga ni opening of the lungs. So inakuanga a little bit painful, that's why they cry. Okay. But if they take longer in crying, kuna kuanga na shida, because now oxygen takes time to get to the brain, and when the oxygen don't get to the brain, utapata mtoto amepata conditions kama cerebral palsy, other conditions zenye ni neurological ni utapata mtoto ako na delayed speech, delayed milestones. So birth asphyxia is the leading cause of neonatal death. Hiyo nayo ni a very danger sign. So for that, it's advisable for mothers to deliver in places that are well equipped. So kama nadhani siku hizi watu hawazai nyumbani sana, and they know about their dates, due dates, because when you come to the clinic, you're being told about the expected date of you to come to the hospital, na masiku zikipitishwa, there's a remedy for that. So for mothers, when you give birth, I've said mtoto anafaa kulia the first immediately. And if they don't cry, we do resuscitation. Resuscitation is basically stimulating them to cry. So with that, tuna resolve the birth asphyxia. So and getting a hospital that is well equipped, unapata mtoto anakewa oxygen ndo aweze kupata enough
supply.
Ndio. Na
labda before tutokea pale daktari, kuna wale watoto wanazaliwa then automatically mtoto analia, na kuna wale wanazaliwa hawalii. Unajaribu hiyo resuscitation vile ambavyo umesema, sometimes it takes long or sometimes they don't, or in rare cases, let me use rare cases, we lose them.
Yeah.
So what contributes kwamba kuna yule mtoto anazaliwa na analia na mwingine anafaili kulia? Is it something that can, you know, I don't know.
No, it's okay. The baby, when the baby comes out, ni reflex. It's a reflex. So that one is biologically made.
Okay.
So utapata probably if the mother has a prolonged labor, mama amekuja, kuna a specific amount of hours a woman should labor.
Yeah.
So if mama for a primi ni mama anajifungua mara ya kwanza, siku ya kwanza, anafaa kuleba for up to 18 hours.
Okay.
But for a woman who has
18
hours.
Wow.
But akienda more than that, that's where we can start having interventions to avoid having birth asphyxia. Another thing is for multipara. Multipara ni mtu amejifungua ndio mara kadhaa. Yeye ni up to 12 hours. Ikipita zaidi ya that, we need to do an intervention. So hizi ndo causes ambazo zinaweza fanya mtoto akose kulia immediately, juu ya kuchoka. Anaweza kuwa pia na cord around the neck. Cord around the neck inawanyonga. So juu kuna hiyo contractions, when the baby is coming out, the cord becomes tighter. So usipopata mtu ambaye anajua kuclamp na kuikata immediately the head is born, it can cause birth asphyxia. Yes.
So this now gives us a call.
Yes.
Kwamba tuhakikisha kwamba tunajifungua hospitalini.
Yes.
Na wakati labor inaanza, we make sure that we don't overstay. Unajua kuna wale wanasema wacha nisikie kwanza. Wacha nisikie kwanza. And then they are going beyond the normal time na complications in a come through.
Yeah. And women are different. So for you, you'd think, oh, it's mild pain, but deep down maybe the progress is faster.
It's faster, yeah.
Or even you can assume for a day or two, but now already the hours of you supposed to labor imeisha. So it's good to come to the hospital, and in our hospital, before you deliver, we do a scan to make sure that the cord is well. Yes. And we can even know position ya placenta, and we can know the number of hours umenini. We even have a machine called CTG. CTG monitors the heart rate, the fetal heart rate. So the fetal heart rate during labor, it should be monitored 30 minutes in every 30 minutes. So because any defect in that will of course show during the labor, during the delivery. Yes.
Wow. Wow. Mtazamaji 22914 na pia kwa Facebook page yetu Mwangaza TV, tuko ndani ya nyumba. Complications ambazo zinawakumba watoto ambao ni wachanga, watoto ambao wamezaliwa chini ya masaa 20 na siku 28, si ndio? Siku 28. So we are talking of mtoto ambaye amezaliwa from birth hadi 28 days. Complications ambazo wanapatana nazo, na ya kwanza kabisa ni hiyo, wakati ambapo mtoto anakosa kupata hewa safi wakati unaofaa. We continue.
So another neonatal complication is neonatal jaundice.
Okay.
Neonatal jaundice is when the baby akona yellowness in the eyes, mikono, uso, around the mouth. So this is
something that can be discovered immediately?
It can be discovered.
Okay.
But we have two types of jaundice. There is pathological and physiological.
Yes.
Pathological ni wakati mtoto amezaliwa, amekuwa handled with infections. So probably staff mwenye anazalisha hajazalisha na clean set, sterile set, ama handling ya mtoto na mama imekuwa si hygienic. And then physiological ni wakati there is no blood incompatibility. So utapata mama ako rhesus positive na mtoto ako rhesus negative. So hiyo inaweza kosa. Another thing, mtoto asipo feed vizuri, breastfeeding, asipo feed vizuri anakuwa dehydrated, and it causes jaundice. So it can be seen. Kuna zile zina happen after 72 hours, and others can be seen even the next day. So one, we do bilirubin test. Bilirubin test will make us know, is it high level for us to do phototherapy sessions. Phototherapy ni wakati tunaweka mtoto under UV light. Tunamweka, so it helps break down the bilirubin in the body. Or saa zingine we encourage breastfeeding and sunlight hivyo tu ndio.
Okay, nice. Tunaendelea.
Another thing is sepsis. Sepsis ni wakati mtoto amepata infection. So you can get a small baby akona a lot of white pimples na zina maji ndani. So that is sepsis. Sepsis pia ni
si joto because most parents wanasema ni joto.
Well, kuna difference, kuna pustules. Pustules ni wakati ni pimple na ina uzaha. Na kuna zile zina maji, kuna tofauti. So wakati hiyo ya joto ni wakati probably memfunika sana, but for pustules utaziona zina pass ndani. So hiyo ndo neonatal sepsis. And we notice it at day 1. Inaanza tudogo, the next day it's a lot. So that one we want to ensure that when delivering a baby we use sterile sets, and we even health educate the parent on how to handle mtoto, washing hands before breastfeeding, or even after diaper change. So that is what can cause that. But with that we do antibiotics for 5 days and it goes off.
Wow.
Yeah.
Kuna mtu anauliza, Seleni ulizia daktari, what causes premature birth?
Premature birth can be caused by a lot of conditions. It could be maternal or fetal. For maternal cases ni wakati maybe you have chronic diseases kama hypertension, diabetes. So for diabetes you can either have a very small baby or you can have macrosoma. Macrosoma is a very big baby and they end up having hypoglycemia because now their intake of sugar is high. Immediately they are given birth, maziwa yako sugar levels haitoshi, unapata now they get hypoglycemia. So those are some of the conditions that can cause premature birth. For fetal cases wanaweza kuwa na ile slow growth, it's chromosomal. They have slow growth, or even kuna kitu inaitwa polyhydramnios. Your amniotic fluid is less, so it makes the baby not to grow. Nutritional cases, wakati mama kuli vizuri, apati enough nutritions for during the pregnancy, so chances are atapata premature labor.
So lisha la mama hapo tu before tusonge, lisha la mama wakati ana ujauzito kabla hajajifungua linaeza changia mtoto kuzaliwa akiwa na defects?
Ndio, a lot. Actually kuna kitu inaitwa spinal bifida. Ni wakati mgongo ya mtoto ina shimo, the spine is not well formed, or even the facial structure inakaa vibaya. So iron supplements and calcium is very important. So kuna IFAS, the tablets that we give daily. We assume not everyone knows how to eat well. So we do give the tablets for the patient or say mother to take daily, and we encourage balanced diet. For that pamphlet ile kitabu ya NC inakwanga na a lot of information. I see most of the clients, they only
but do they even read the
they
booklet?
Only take the booklet during clinic. So siku ya clinic ndio wako
you filled.
Exactly. But that book is it has information. Your diet, how you're supposed to take care of yourself, the danger signs, danger signs za mtoto zote tu ziko well labeled hapo. So as much as you're coming to clinic, get time to pass through the book, read the book, and you'll get to understand more.
Wow. 22914 na pia kwa Facebook page yetu Mwangaza TV, tuko ndani tunaangalia complications ambazo upata newborns ama wale watoto wachanga ambao wamezaliwa, na tumesema kwamba when we talk of newborns we are talking of mtoto kutoka wakati anazaliwa hadi siku 28 or 1 month, but hiyo nimeongeza za kwangu up to 28 days. So changamoto zipi ambazo watoto hawa wanapatana nazo? Premature birth, I think you've responded to that. Walikuwa naongelelea maybe do we have other complications?
There is hypothermia. Hypothermia is when the baby has lost a lot of weight. So this starts from us, the healthcare workers.
Lost weight from the
they
time
lose
it
heat,
was born.
Heat.
Ndio nasema that you determine from the time the kid was born?
Yes.
Okay.
So immediately the baby is born, we have receivers.
Yeah.
So when you receive the baby, of course, the first thing as a midwife, you wipe the baby.
Yeah.
While stimulating them.
Okay.
So immediately you wrap them, you remove that wet cloth because they easily lose weight, especially with their head, because it has a higher circumference. So you make sure that the baby is not in a room where there is an active wind. The doors and windows should be closed.
Inachangia mtoto ku lose weight?
Yes.
I didn't know that.
Weight is energy.
I didn't know that.
Yeah.
Wow.
So when they lose a lot of weight, heat, they lose weight. And even when they cry a lot, they lose weight. Yeah, because it's energy too. So while receiving the baby, you make sure that the baby is warm, and they should always have a kofia. Akwe amevaa tu kofia most of the time. And while showering the baby, you start with the head. You take a sponge, you make sure the head is clean, and then avae kofia as you wash these other parts. So I think hapo kuna kwanga na gap juu mama anacha mtoto tu wazi. The windows are open, there is the conventional wind. It goes and the baby loses weight and they get hypothermia can be crucial. We can even lose a baby from that. Yeah. So keeping them warm and comfortable, it really helps.
Wow.
Yeah.
We've had issues na mtoto ambaye anazaliwa and then ako na feeding complications. Maybe mtoto hanyonyi ama akinyonya kanatoa. Yes, that one happens too. So with that, inakwanga ni reflexes tu haijakuwa stimulated, and it's a common issue nowadays because you get the baby the first day mtoto hanyonyi kabisa, but we stimulate the reflexes. You try, it's called a moral reflex. Unamweka kidole huku until they get to know how to suck. It's just kitu kama practice tu, but kuna wale wanatoka and they know how to. So it can either be the baby knows how to suckle and there is low milk production, or the mother has plenty of milk and the baby is having an issue of latching. So inakwanga the balance of trying to assist the mother in supplementing or even assisting the baby to stimulate the reflexes. Ndio. Is there something that can be done, especially, I know this may be off topic kidogo, but is there something that can be done kusaidia a mother, vile umemention a mother ambaye mtoto reflexes ziko sawa, anataka kunyonya, anajua kila kitu, but then I have minimal milk supply. Yes.
Well, during NC clinics, we've said about the nutritional. So of course there is that part of taking plenty of water.
You as a mother?
Yes, as a mother. Taking plenty of water is really crucial in pregnancy and even while breastfeeding. It really supplements. As much as that, nowadays we have a lot of supplements that you can put in your tea, porridge, which can stimulate the production. At the same time, we have different kind of mothers and our anatomy are different. So there are mothers who don't have issues with their nipples. So the nipples are just formed well, but there are mothers who have inverted nipples. So during the clinic, of course, when you come for the visits, we even check your breast. And if we notice there is an inverted nipple, there is a way we can show you how to stimulate it to come out and even have a pump to pull it out. So when you continue pulling it out, after the delivery, it will have formed well. So it won't have an issue again. Thank
you. And for the issue of yule mtoto ananyonya na ana vomit,
for that is GAD, and sometimes it's just reflexes forming. So we check on that and there is a remedy for that. So we can sometimes the baby is allergic to something, which we check on it and we do IV therapy. IV therapy is when we do, because we don't want the baby to get dehydration. Dehydration can cause jaundice and other complication. So we do an IV therapy. We give fluids for some time until when the baby can be able to retain the food. Mostly it's because of the suctioning. During birth utapata mtoto maybe amekunywa meconium. Meconium ni maji ama choo zile zimekutana na choo yake, not the mothers. So utapata hizo ndo zinatakanga tu kutoka after a good suctioning. Suctioning ni kuvuta uchafu, they get to pick up. Yes.
All right. Thank you. Presley unasema Naivasha you're following. Naomi unasema hello, good morning, I'm following. Geoffrey you're present. Philip Lesha unasema niko ndani tuko pamoja. Alafu unasema Naivasha kwema, you're following. Blessed Favor you're following. Alafu Irene swali lako I think limeweza kuwa responded to. Ulikuwa unauliza what causes premature death kwa premature birth, not death really. Why am I running to death? You know, premature birth. And then someone else anauliza kwamba mimi ningependa kujua ni nini inasababisha watoto wachanga wanakuwa na joto ovyo ovyo, wanapatwa na joto ovyo ovyo, and if it is okay kwa mzazi kupatiana painkillers kwa huyo mtoto. I think that is something you're going to respond to. And then we are also going to talk to Mercy. Anasema kwamba mimi niliambiwa kwamba nimezaa mtoto ambaye lungs zake zilikuwa underdeveloped. Ningependa kujua what causes that.
Okay.
Yeah. I think let's respond to those two.
Okay. I will start with the fever.
Yes.
Fever is a very common challenge in babies, and it's just an indication that the baby probably has an infection or the baby is dehydrated. When the baby is not having enough, not plenty, enough breastfeeding, they get dehydrated, and when they get dehydrated, the fever spike up. So if it's a baby from 0 to 28 days, you make sure that the baby is breastfeeding frequently. And when I mean frequently, I mean they should not stay up to 3 hours before breastfeeding. So every 3 hours the baby should breastfeed and stay in one breast for up to 30 minutes. To make sure that they have fed well. So unamnyonyesha for 30 minutes. The next time you're feeding the other breast. So with that they get enough of breast milk. And if it's okay to give painkillers, well, it's not pain. We have painkillers and we have anti-inflammatory. For anti-inflammatory, if it's a condition caused by inflammation, because at home you won't know what is the cause. It's good for you to come to the hospital. We will help you in making decision which is the best intervention to take.
Also, see, kila wakati mtoto akiwa na joto unampa painkiller.
No, because
not all of them are in pain.
Yes, they're not in pain, and probably you're treating something which is the underlying cause. You don't know what it is.
That's true.
So they'll get the inflammation over and over and over.
Wow. I like that. I think ini something that has gotten really down to us as mothers. Mara nyingi huwa tunaona joto, mtoto akona joto, hebu leta ile let me not mention names. Leta ile painkiller, and then unapea mtoto, alafu unasema ametulia, and sometimes we are doing this without really knowing why. The temperatures are high as such. So jamani, it's always good to seek your medical direction. And then I want us to respond to mtoto ambaye anazaliwa na undeveloped lungs.
So what happens during the pregnancy period, there is something called surfactant factor that is formed in the baby's lungs. So this one is the one that helps the contraction and the relaxation of the lungs for the baby to be able to breathe well. So if a patient comes in, there are early signs of delivering. So this baby definitely was born prematurely. So when they come, the mother comes in and they have an issue.
Is it before you continue, is it always a must that mtoto aliye na complications za lung nini anazaliwa prematurely?
Not necessarily. Okay. Sometimes it's just a defect. Now the surfactant was not formed.
All right.
So when the patient comes in and they have a sign that they have a premature labor, there is a medication that we administer twice for it to stimulate the production of the surfactant factor. Okay. So with that, it's still the same. Going to the hospital if you see any signs. Danger signs in pregnancy includes bleeding or premature rupture of membranes. Rupture of membranes means that umemwaga maji kabla ya masiku. So that one, na ujafikisha miezi 9. It's good to rush to the hospital for you to be given the medication prior. So that it can help produce the surfactant factor. So it's good to go to the hospital. The other danger signs in pregnancy is having cramps that radiates to the back, and you're not 9 months yet. So those are the common danger signs.
For someone ambaye amemwaga maji mapema, the
amniotic fluid, yes,
na maybe ako katika mwezi wake wa 7 ama ali mwezi wa 8, okay, she is not due. Anapokuja hospitalini, is there a refill? Ama huyu mnambring to labor?
So that one is God made. We don't do refill.
So what do you do? Because this kid, mtoto anastahili bado kwa hayo maji na anastahili kugrow.
There are cases that we encourage bed rest.
Okay.
If the amniotic fluid did not drain all of it.
Yes.
But if it drained everything and the cervix, of course, when the amniotic fluid drains, the cervix of course it opens. Yes. And you can't keep a baby in an open cervix. True. So of course that one we will just deliver the baby and we will have them in a newborn unit. Okay. So in a newborn unit, there are incubators that are formed that are almost near to be like your
the
womb.
Uterus,
Yes. So they keep the baby warm and you get to feed the baby from inside. They get the warmth that they are supposed to get for the growth to continue.
Okay.
Yes.
I needed to know that because I know someone else anauliza sasa maji kimwagika, where do I go from here and what do I do, and you know how do I start? Beautiful. So anything else we need to know about the newborns and their complications? I
need to add something. If your water breaks, just go to the hospital immediately, because one, even if you're due, you're prone to getting infections. Yes. So it's good for you to rush to the hospital. Even if you're not going to deliver the same day, you'll be covered by an antibiotic. Because already you'll have exposed yourself and your child to an infection. Yes. So always rush to the hospital. Yes. And for those of us, nowadays it's a trend. Ambayo inaendelea sana. Hata mitandaoni unaona people are preferring to, you know, to deliver at home. Kuna yule anasema anataka kudeliver na hot bath. Wale wanataka kudeliver. There's so many norms, so many idioms going around here and there. You as a medic, what is your say on the same? If it's a place, you know, delivering, it's basically in a place where it's fully equipped in receiving your baby, in helping you, and in case of an emergency, am I able to fully assist you? So, well, water bath is not bad, but now is the place well equipped? Is it with a medical officer? Yes. So that one, if it's not, then it's not safe. If it's not, it's not safe. Wow. So you've talked of feeding, you've talked of warmth, you've talked of hygiene, you've talked of, you know, mothers being given rest, especially wakati complications in arise just before they deliver. And then tuko na hawa watoto, especially sasa wale ambao mmeshughulikia, maybe the oxygen whatsoever. Are there conditions zenye zinaweza remain persistent even after the medical team imeshughulikia watoto? So these ones, maybe we say congenital birth defects. Those ones can stay. Congenital birth defects are conditions that are, I don't want to mention them as disabilities,
yeah.
but they are, and these can cause suppression in many things.
Yeah.
So if your baby is born with a congenital defect, they can have an issue with feeding, they can have an issue with breathing.
Yes.
So these are not things that can be resolved immediately. So it will have a persistent and follow-ups in the hospital.
Yeah.
So if the baby has a clip palate, you see they'll have an issue of breastfeeding,
yes.
Or even they have issue with the chest. There are some disabilities that can cause that. Cerebral palsy, that will make the baby have a lot of sanctioning to do. So that one will not resolve immediately, but with a lot of follow-ups with therapies and sessions, it will be able to clear out as they grow.
Wow.
Yeah.
Thank you so much. Your final remarks as we wrap up our show today.
For mothers, I would really encourage you to make use of hospitals. We are always just seated there waiting for you to give you information about how to keep your pregnancy, how to help your kids, and even health educate you on how to raise your babies. It can be challenging if, well, you're the first time mother, or even, you know, babies are different. You could be having a smooth ride with your firstborn and the secondborn is having an issue. So we don't have a problem. Always jump in the hospital, ask information, and don't fear, don't feel judged while asking questions. Just ask. We are always ready to help. For someone who is watching us today and asks now, if I purpose to go to Jesse, maybe what are some of the care? So we have the outpatient services, we have the radiology, our lab is fully equipped, we have the inpatient, we have 2 operating theaters. So the facility is big. We have a pediatrician, and many things. We have even a pharmacy. You can walk in and buy something from there, and we are always ready to serve you.
All right. Thank you. And you've told us that you're located
in Lumumba Drive, just next to Park University.
All right. Kutoka kwangu nisemeje, thank you so much for coming. May God bless you once again. You've honored us today, and we are glad, we are happy. Yes,
happy
at least we know, for those of us who are preparing to be mothers, those who are you know, you're working towards stepping into that category ya kuitwa mama, and those of us who are due, you know, na hatujui tuanzie wapi, na you're afraid, hujui mtoto atazaliwa aje, atafanya aje. The earlier you get the information that you're lacking, the better, because the medical team can always work with you, wanakuadvise, wanakupa, you know, wosia kuhusiana na lishe, and even when you're bringing forth that life, you're doing it in an environment ambayo with all the care available, anything going wrong will be, you know, captured early enough. So we really thank God, and we advise, we still call on you to make sure that unatafuta, you know, usaidizi kwa hospitali iliyo karibu nao. You know, you may be watching us and you're in Kisumu, unasema sasa mimi nitaenda aje hadi Nairobi. No, wherever you are, si kuna hospitali iko hapo karibu. Just make sure that you are walking with the advice of the medic. Hauko peke yako, because tunataka huyo mtoto azaliwe akiwa mzima, akiwa sawa. Thank you so much mtazamaji kwa kuwa pamoja nasi. Tomorrow is another day. It is a family Thursday. Tutakuwa tunaangazia masuala mengi sana, tena sana ndani ya nyumba. Yani usitake kukosa. Wenzangu ambao umefanikisha kipindi asubuhi ya leo, thank you so much. May God bless you and do you well. Tutapatana kesho, bado ni siku, na kutoka kwangu Sele, mimi sina la ziada, lakini kumbuka kitu kimoja, be careful not to miss out on your promise. That is the word of the day. Be so careful not to miss out on the promise of God over your life and over your generations. And now may the grace of our Lord Jesus Christ and the love of God and the fellowship of the Holy Spirit be with